Population Fund office in Geneva. We come together today on the 1st of October to celebrate the International Day of Older Persons in its 30th anniversary. The theme for 2020 is Pandemics, do they change how we address age and aging? And this year's theme is an occasion to highlight the participation of older persons in society, but also to raise awareness of the opportunities and challenges of aging in today's world with a human rights-based approach, of course. COVID-19, as we all know, has had a disproportionate impact on older persons. While there are still many serious challenges ahead of us, new opportunities have also arisen this year. And one of them is for sure the decade of healthy aging that was endorsed by the World Health Assembly on the 3rd of August. The decade does create an opportunity to mobilize local, national, and international communities to improve the lives of older persons, their families, and communities. And we'll be able to hear more about this in the coming hour. This event will be divided into two segments. For the first half, we will hear the messages of UN heads of agencies, funds, and organizations to rally international community behind the older person's health and human rights agenda. And we will also hear the perspectives of the private sector and how they can contribute. The second segment will take the form of a panel discussion among some of the most relevant stakeholders, a government official, an international human rights expert, and a civil society activist representing a global network of older persons organizations. Before starting, let me just share with you some housekeeping rules. The session will be live streamed in the WHO and the World Economic Forum websites, and a recording of it will be made available soon. If you want to tweet about our event, please use the hashtag UNIDOP2020, and also keep tuned with the chat box. We will share with you some relevant information on key issues that will be discussed in the next hour, and also you will be able to send questions and remarks that we will share with our panelists. Let's make this the most interactive as possible, please. But now, without further ado, we will hear from 3 UN leaders coming together to emphasize the nexus between the global normative framework on the rights of older persons, the need for global collaboration to foster healthy aging, and to ensure the UN has an impact in countries. We will start with Her Excellency Michelle Bashley, United Nations High Commissioner for Human Rights. High Commissioner, could you please tell us where do the human rights of older persons stand today in these troubled times, and how can they be brought to bear? Madam High Commissioner, the floor is yours.
Thank you, Monica. Excellencies, colleagues, and friends. As we all know, we are commemorating the 30th anniversary of the International Day of Older People at a very challenging time for us all, and in particular for older people, in terms of medical harms and the fear of contagion, as well as social isolation, loneliness, poverty, and unemployment. Older people are deeply vulnerable, especially those living in care homes and institutions. In many, perhaps most countries, the pandemic has exposed economic, social, and legal systems that have long neglected to prioritize the protection of the rights and dignity of older people, including their rights to health, social protection, and decent housing. As a matter of urgency, we need to encourage all states to fully integrate a focus on older people into the policy responses to COVID-19. In many countries, there is a clear need for social care reforms that prioritize individualized support to older people and promote their full inclusion in their communities. Looking forward, as society builds back from this devastating pandemic, we need to seize the opportunity to build back better, not to return to the previous status quo, which created gaping entry points for the virus to exploit on, even worse, to accept our current context as the new normal. We need to build systems that uphold and advance the human rights of older people and empower them to live full, free lives in dignity and equality. To do this, we must shift our narratives around older persons, moving away from an ageist, paternalistic view to one anchored in full respect for the equal rights and dignity of people of all ages. Older people are as diverse as any other population. Assuming that they are necessarily frail and dependent is not only inaccurate, it is harmful to all of society. Older people are an essential element of the solutions our societies so urgently need today. Older people can bring crucial experience and expertise. They may have tremendous potential to contribute, and many already do, contributing actively to the pandemic response, as well as to the well-being of their families and communities. We need to expand rather than diminish the role they play in all aspects of our economy and social life. We need to support their contributions at work, in the community, and at home. We must also address structural barriers to better protection of the human rights of older people in the longer term. This includes doing much more work to legislate, uphold, and deliver economic and social rights, such as social protections, and civil and political rights, such as ensuring their full participation in decision-making or upholding their autonomy and independence. The lack of a dedicated international protection regime for the rights of older people is perhaps the most obvious and urgent normative gap. We need to accelerate current efforts towards developing a new international human rights convention on the rights of older people, which will give us much needed international standards to guide our actions. The proposed new UN Decade of Healthy Aging 2020-2030 could be a key global platform for greater collaboration and action by all of us, states, UN, and intergovernmental entities, and of course, civil society. More inclusive, equitable, and age-friendly societies will be more resilient, as well as safer, more prosperous, and more fair. In a year that has seen so much terrible harm to older people, I hope we can use today's event as a springboard for strengthening efforts to advance their dignities and rights. Thank you very much.
Just a technical issue. Thank you, Madam High Commissioner, especially for highlighting the need to fill the normative gaps in order to address once and for all the structural barriers that perpetuate ageism and discrimination against all persons that prevent them, in your own words, from leading full free lives in equality and dignity. That's a very compelling message. Thank you for that. We now move to Dr. Tedros Ghebreyesus, the Director General of WHO. As we've heard, the High Commissioner ended their intervention mentioning that the Decade of Healthy Aging will be a great opportunity to place older persons at the center of the health policy agenda. What can you tell us about this approach in such turbulent times? The floor is yours, DG.
Thank you. Thank you, Monica. Thank you so much. Thank you for moderating this very important subject. Excellencies, dear colleagues and friends, thank you for joining us to celebrate the 30th anniversary of the International Day of Older Persons. And I'm proud to be here with my sisters from the UN family, former President Michelle Bachelet, the UN High Commissioner for Human Rights, and Dr. Natalie Kennedy, Executive Director of the United Nations Population Fund. Earlier today, I had a conversation with Sir Captain Tom. I'm sure many of you have heard of him. He became an international hero when he raised nearly 100 million British pounds through a charity work for his 100th birthday. By the way, I will tell you some other days, but he told me the secrets behind this long life, 100 years. Captain Tom's life is our history. He was born on the tail end of the 1918 influenza pandemic. He lived through the Second World War and the first moon landing, and of course the birth of the internet. So he has passed through several changes actually globally. And yet he is a man of the present day, contributing to the COVID-19 response and bringing hope to millions. I even called him to Tom, you're a man of hope and unity. And that's really true. His messages were amazing. The virus, as you know, has revealed the strengths of older people like Captain Tom. He is not alone. By the way, he has a song which is titled, "You Will Not Be Walking Alone," or "You Will Not Walk Alone." We sang it together, by the way, at the end of the interview. It really can uplift anyone. And that's why we said he's a man of unity and hope. And that song gives hope, all ages, an amazing man anyway. Health workers have come out of retirement to lend their expertise to colleagues on the front lines, while other older people have volunteered to support their communities. I thank all the older people, especially health and social care workers, who have worked together to respond to the pandemic. Despite these efforts, the COVID-19 pandemic has taken a heavy toll on many communities. Older people have been especially hard hit. I want to express my sincere condolences to the friends and families of older people who have died during the COVID-19 pandemic. The virus has shed a harsh light on the vulnerabilities and inequalities in health and social care systems and long-term care facilities. We have an opportunity to change that. To foster healthy aging, we need to work together. Older people must be central to and fully engaged in this collaboration. The countries of the world who are our member states have endorsed the Decade of Healthy Aging, a collaboration to improve the lives of older people, their families, and their communities. In practice, that means keeping alert for ageism, as Bashley said, and supporting older people by engaging them in the community, providing responsive healthcare and quality long-term care for those who need it. We hope that this will be taken up by the entire UN system. I'm also pleased to announce that today, WHO is launching a webpage that will monitor global indicators of the health and well-being of people 60 years and older. They need our attention. This will allow us to track progress towards the targets of the Decade, Healthy Aging, and the Sustainable Development Goals. Thank you all for your commitment to ensuring older people receive the opportunities, the respect, and the care they deserve. I look forward to today's discussion. I thank you.
Thank you so much for the message of hope and unity. You are also a man of hope and unity, and for highlighting that we are not alone and that older persons need to be central and fully engaged. It's really something that will resonate with all of us. Now I'm honored and humbled to introduce to the audience my own boss, Dr. Natalie Kennedy, Executive Director. She didn't join us live, but she recorded a special video message for us to align with this discussion. Can we?
Excellencies, dear colleagues and friends, the world is different as we celebrate the 30th anniversary of the International Day of Older Persons this year. We keep our aspirations for healthy, joyful aging, even as we fundamentally rethink how we see, treat, and include older people in society. UNFPA is partnering closely with governments and with dynamic older persons organizations. We're helping to revise population policies to reflect the needs and the voices and the wisdom of older persons, and ensuring that older persons' viewpoints will guide national decision-making. Yes, COVID-19 is a wake-up call. The pandemic lays bare the devastating effects of ageism, from denial of healthcare to worsening poverty and social isolation, to abuse and even neglect, to poor mental health and well-being. In our COVID response, UNFPA and the United Nations and civil society partners take a proactive, positive approach. We're providing protective equipment, guidance for staff in care homes, and informing older people about how to protect themselves. Young volunteers mobilized by UNFPA are making visits to elders to lessen their social isolation and loneliness and to assist in carrying out daily routines. The country of Mauritius already had a new population policy in place that prioritizes older persons. That prepositioned the government to support older people when COVID-19 struck. And in Iran, UNFPA is working on legal and policy frameworks for age-friendly environments. In Georgia, our programs help older people remain independent, active, and involved. Today, the UNFPA Regional Office for Eastern Europe and Central Asia, together with the World Health Organization Europe, the United Nations Economic Commission for Europe, the Office of the High Commissioner for Human Rights, and HelpAge. We're joining together to launch a program to step up our COVID-19 emergency responses and advance new models of health and social care to ensure the human rights and dignity of older persons in the region. While more and more people enjoy a healthy, active old age, the pandemic does reveal the vulnerabilities of those who may be left behind. This includes people facing intersectional discrimination based on age, gender, socioeconomic, and other factors. One more thing, applying a gender lens is essential as governments address the specific challenges faced by older women who are often more at an economic disadvantage or at a heightened risk of violence and in need of stronger social protections. UNFPA has launched its COVID-19 Population Vulnerability Dashboard earlier this year. The online maps highlight the locations where older people live and the services available. Disaggregation of data, it helps identify and improve access to data about older persons in all their diversity. Let us learn from the pandemic. Let us uncover and end age-based discrimination once and for all, and promote intergenerational solidarity. We wholeheartedly support the Decade of Healthy Aging because it offers a renewed path to galvanize concerted action, to better the lives of older people in their communities, and to leave no one behind. If we make this crisis a turning point, then older people will enjoy a more just and equal world, one with health, well-being, and dignity to be enjoyed by all at all ages. Thank you.
And I have to say thank you, Natalie Kennedy, for this. As you've heard, Natalie showed us how UNFPA, as an operational development agency, what we do on the ground in collaboration with the rest of the UN system to meet the essential rights and needs of older persons, and also to promote partnerships with older persons and their organizations in order to drive policy change. And now, benefiting from the fact that we have the High Commissioner and the Director General with us, I would like to ask your reaction and your guidance on how do you see the UN system and the whole of society coming together to advance the rights of older persons in the next decade. We want your inspiration. Should we start with the High Commissioner? Yes, High Commissioner.
Thank you, Monica. As the Secretary General recently remarked, coming out of this crisis will require a whole of society, whole of government, and whole of the world approach driven by compassion and solidarity. For the UN system to move forward in building age-friendly societies, we need to connect the normative human rights imperatives with policy commitments and practical actions. My office is committed to continue working together with WHO, with the organization, other partners to advance the healthy aging decade as part of our joint framework for cooperation. And Natalia just mentioned they have a joint regional program that has been launched today, where we are also part of that with the rest of the colleagues that trying to continue and uphold the rights of and dignity of older people in COVID-19 response. But above all, as we move forward with the decade, we need to bring the voices of older people in national decision-making and in global UN processes. Yesterday, talking about older people as well, I said that in my experience, being a minister and afterwards, I saw how dynamic the older people organizations were in my country. So, and I was aging as well. So I developed a concept that it was that I was not old. I had accumulated youth because I felt so young in terms of the desire to continue contributing in many things of my life. So with that accumulated youth, I want to look forward to working with you all to create a whole of society approach to strengthening the enjoyment of all human rights by older persons across the world. Thank you very much.
Thank you so much. It's really a good homework for all of us. DG, you have the word now. You have the floor now.
Yeah, but Michelle said everything. So I will say one thing, concurring with all that she had said. One thing that I would like to add is, we have to improve our mindset. It's a mindset issue. We say, for instance, when there is a youth bulge, you call it could be a demographic dividend. You see it positively. And when you have the elderly, people tend to be negative and they say silver tsunami. But I don't agree with that. We should actually treat the elderly as silver dividend. At the end of the day, whether it's youth or older people or the senior citizens, what matters is our mindset and the way we involve them. If the policy of any country is right, they could be silver dividend. Even youth, it could be a silver, a demographic dividend, or it could be even a bomb. It's the way you use it. So use doesn't mean that you have use budget doesn't mean that you have advantage. So the most important thing is we have to correct our mindset, and we have to believe that the elderly can continue to contribute. And if there is any problem, it's a policy issue. It's the problem of the country itself. With the right mindset, the elderly can be a silver dividend, and they can continue to contribute to their countries. So look, Tom Moore, Captain Tom Moore, he's 100 years old and he's contributing. And I know many contributing. So that's what I would like to say. It's a mindset issue, and we have to see what they can bring to the table, and that they are not dependent, and they can continue to contribute to society, and they are productive part of the society. And we have to find out how to really use all that they bring, starting from the wisdom. Thank you so much.
Thank you both. I won't even dare to try to sum up what you just said, but for sure the mindset, the narrative, the need to hear the voices, and the fact that it has to be followed by policy changes, by filling in normative gaps. I think that's one of the major takeaways from this meeting. And I just have to thank you both, and including Natalia, for making the point of being today in this very critical event, in this very important event, because it's also the 70th anniversary of the UN. So this is a strong argument to reinforce multilateralism and the multilateral response to this agenda. And I'm gonna say farewell to the two of you by wishing you a good International Day of Older Persons, and with celebrations, with inspiration, and with participation, and also saying that you are role models for all of us with your inspiration and your guidance. Thank you. And now I have the honors to ask the team to show a video that was prepared by Professor Klaus Schwab, the chairman of the World Economic Forum, where he's going to highlight the need for this partnership between private sector, government, civil society for advancing the rights, dignity, and well-being of older persons. Thank you.
Dr. Tedros, Dr. Natalia, Dr. Michelle, Excellencies, and honored participants. Today, October the 1st, marks the 30th anniversary of the International Day of Older People. As the international institution for public-private cooperation, the World Economic Forum is putting its full weight behind the topic of healthy aging and longevity to create a world in which everybody can live a longer and healthier life. As the COVID-19 pandemic has shown us, much needs to be done to foster healthy aging and how we respond to the opportunities and challenges of aging in today's complicated world. The forum, together with its future Council on Longevity, convened actually 5 conversations about COVID-19 and aging societies with hundreds of participants across the globe. The discussions focused on promoting healthy aging, combating ageism, and developing communities that foster abilities of older persons. A compendium of the recommended actions that emerged from those dialogues will be made available to the public and to policymakers and societies at large in the coming weeks. We are committed to playing our part, and we will help mobilize business to be an important agent of solution to realize the vision of the decade of healthy aging. In January, at our annual meeting in Davos, we launched the Davos Alzheimer's Collaborative, a joint initiative together with the Global CEO Initiative on Alzheimer's Disease. This is a 5-year, $300 million effort dedicated to accelerating treatment and innovation in the field of Alzheimer's disease. The focus of this collaboration is to enable shared research assets and to ensure that when disease-modifying drugs and treatments become available, healthcare systems around the world will be ready for patients to access them universally. This illustrates our commitment to innovation in responding to the big challenges of our time. As someone who would fit into the category of older persons, but who looks back to nearly 20 years of a healthy and very productive life after the retirement age, you can imagine that I'm here today with you, not only with my brain, but with my heart. Your Excellencies and honored participants, we would like to affirm again that the World Economic Forum is fully behind the initiative of the decade of healthy aging and its utmost significance to current and future generations.
Thank you, Professor Schaub, for this commitment and also for your very strong message. I would encourage you all to check the chat box, because there's a lot of information being provided there. The agencies are putting their reports there. The NGOs are sharing also their knowledge products. It's quite interesting and quite rich, and also use that to send comments to all of us. And now I am going to start with the second segment of this event. So we're going to start a panel discussion, and as I was saying, we will have one government official, the international human rights experts, and also the civil society representative. And we're going to exchange further views on the issues introduced during the first segment. My first panelist is Dr. Hanadi Halamat, the National Lead for Healthy Aging in the Ministry of Public Health from Qatar. Dr. Hamad, WHO member states have recently endorsed the Decade for Healthy Aging Action Plan. What commitments has your country made to support healthy aging and empowering all the adults? Can you share an example you are most proud of? Dr. Hamad, the floor is yours.
Yes, thank you for invitation and thank you for inviting State of Qatar to be part of this excellent day. Indeed, the State of Qatar endorsed WHO Global Strategy on Aging and Health in 2016. Okay. And we have demonstrate our commitment to enhancing the care of our older population over the past few years. Qatar National Health Strategy was published in 2018 here in Qatar, and we identify healthy aging as one of our priority in this strategy. So we have population-wide for elderly 65 years and above. We have a strategic aim, our aim to increase the healthy life years to our population and elderly group. All our efforts have been geared to providing more targeted healthcare services and meet the specific needs for older people. The strategy developed in collaboration with different stakeholders. We engage our patient, we engage our caregiver to be part of this strategy. One of example that really I'm proud to and I want to share is establishing elderly helpline, and this provide easy access for our elderly and caregiver to find the service needed as soon as possible. Other example, under National Health Strategy, due to the stigma here and culture issue, we draft dementia plan to be under National Health Strategy, because one part of that initiative, monitoring and addressing need of cognitive impaired elderly. So our plan, dementia plan, published also in 2018, and this has paved the way for the launch of National Alzheimer Helpline. Today, we also, in our Elderly Day, we will publish a website dedicated for elderly. Yeah. Thank you.
Dr. Ahmad, can I follow up with a question? So the main message learned from your effort on how to address pandemic and its impact on older adults, what would be the key message you would want to share with us?
During the pandemic, really it was a difficult time for all of the country, but here in Qatar, we have secured our elderly. And I divide our strategy for threefold. We started here to reaching our population and our elderly through sending SMS messages to all elderly here in Qatar. Providing with general information about COVID-19, give them information about important to be socialized and cognitively engaged. In addition, we give them some message, it was weekly message, sending weekly message to our elderly. And on that context, also we have campaign to spread the health information regarding COVID. This is one of the initiative. Second fold, also, we have start initiative, we call it Telephone Reassurance Call Center. We approach our elderly and we call them at home and ensure that they are okay. And if they have anything affecting their well-being during COVID, we find through our team a way to let them get in the system. The last initiative, which we brought about it, we do have a long-term facilities here in Qatar. And through collaboration with WHO, we have a very strict infection control measure. And during COVID, we don't have any problem in long-term facility here in Qatar. So thank you for this question.
Thank you so much for sharing with us those lessons and those good examples. As we say, it's in country level that the magic happens and all that we discuss comes into fruition. And now I'm honored also to present and to introduce to all of you someone who doesn't need an introduction, but Dr. Claudia Mahler. She's the independent expert on the enjoyment of all human rights by older persons. And of course, your appointment came in a very critical moment at the height of the COVID pandemic, and it's also coincided with the endorsement of the decade for a healthy aging. So I would like to ask you, from the perspective of your mandate, how do you see and what do you see as priority actions that need to be taken to strengthen the human rights of older persons in the next 10 years? How do you see the decade of healthy aging contributing to them? Claudia, you have the floor.
Yeah, thank you so much. Thank you for inviting me, dear Excellency, colleagues and friends. Thank you for the question. I think one central aspect of my mandate will be to move the rights of older persons to the center of the political and policy areas. We need to encourage all generations to see aging as an opportunity and not only as a challenge. Ageism and age discrimination cut across the full spectrum of the violations of older persons' rights. Ageism is also among the root causes, hindering older persons from enjoying their rights. This again came to light during the pandemic, and we need to ensure that age is implemented as a ground of discrimination. This would have a major impact. The data gap is another overriding theme that needs to be addressed as a matter of priority. It is an alarming sign of exclusion, moreover renders meaningful policymakers and normative action practically impossible. This is a need to more systematic and dedicated research on older persons, and I see synergies with the global research agenda. During the pandemic, we witnessed that the impact was a key one. Another key concern remains care and long-term care, including palliative care, that continues to be high on the agenda, which needs to be developed as a right, and the decade can give a meaningful impact on this. Finally, for this part, I would see that many areas where the decade helps to reinforce human rights of older persons, protection, action, and I see a lot of synergies complementary with the decade for healthy aging. Thank you.
And that leads me to a second question, if I may. So in moving forward with the decade, how do you see that we can better strengthen the accountability for actions, which is a critical question? What role can human rights system and national human rights mechanisms can play in this regard?
Yeah, thank you so much for this wide and broad question, and an important one. The obstacles of older persons around the world facing enjoyment of their rights are not new. What we have sadly seen during the pandemic is that violations of older persons' rights were heightened in all areas of life. This has shown once more the current instruments do not specifically or adequately address the issues of aging and fail on older persons. Crucial areas are not covered extensively. We need to ensure to get data, to have access to justice and remedies and redress. For effective measures, we have to further the participation of older persons because they are the experts. Furthermore, we need to have indicators to monitor the impact of the measures. The recovery is an opportunity to set the stage for a more inclusive, and equitable, and age-friendly society. All actions must be anchored in human rights, and we also have to ensure that older persons are participating in the policy making and that their needs are taken into account. In this regard, we really have to join our forces. For example, NHRIs function as a translator of international agendas to the national level, which is one specific part of their mandates. NHRIs work on all levels and get in touch with civil societies, governments, and other key stakeholders. They are the ones who can help to further the human rights-based approach of the decade. To make it an important tool to raise awareness at the global level, the decade is a trigger to make older persons more visible. It is my role and the role of the human rights system to expose the existing gaps and to provide an in-depth analysis of the issues that need to be concretized in order to ensure a better protection of the rights of older persons. This includes to explore the synergies with the decade, to engage with WHO and UNFPA and others to strengthen accountability of action. We have to join our forces to construct a more inclusive society based on non-discrimination and equality, respect for human rights and dignity. Thank you.
Thank you, Claudia. And taking the lead from your last remarks on joining forces, I'm going to join forces now with civil society, and I'm now introducing the third panelist, Silvia Perez-Levin. She's the chair of the NGO Committee on Aging in Geneva, and she's also the representative to the UN of the International Network for the Prevention of Elder Abuse and International Longevity Center Global Alliance. Silvia, our speakers have mentioned the importance of participation by older persons in society, and we just heard that call again from the independent experts. What is the current situation concerning the level of participation? Can you share an update with us, please?
Thank you, Monica. The question is, what do we mean by participation? Yes, older persons, as we heard, play multiple and crucial roles in their families and communities. We do not just contribute to society, we are full agents. By necessity or by choice, we work whether paid or on a voluntary basis. We live, and if we are lucky, we love and are loved by friends and relatives. But multiple barriers limit the extent of our participation because of prejudice, wrong assumptions, or multiple and intersecting discrimination. Too many live in poverty without access to an adequate income or standard of living. We want to be supported and enabled to decide where we live and with whom, what type of care and support we receive. Too often, decisions are being made for us, taking away our freedoms, denying our autonomy, who we are. Our participation cannot just be confined to our inner circles of social care. We need new skills to cope with an ever-changing digital world, but too often we lack access to either the tools or training. We lack choices. We are an integral part of society, and we have the right to fully participate in decision-making processes, to be equal partners in policy-making, to have a say and be heard. Our rights do not expire, but too often we do not enjoy them. We can bring the barriers down. Older persons and organizations that represent us are changing the narrative. We are here and demand recognition for a full, meaningful participation. Thank you.
Thank you, Sylvia. And on participation, we've discussed this multiple times, but what has the current pandemic taught us about the future of participation of older persons and of the organizations that represent them? I think it's one of the key issues.
This pandemic has shown us not only that the high, painful, and tragic price we all pay when adequate services are not available and when societies discriminate, but it has also shown us that communities and countries that had in place age-friendly policies fared better during COVID-19, that our demands are not out of reach, that we have a voice and we use it. Now more than ever, we call for a UN Convention on the Rights of Older Persons. Such a convention will assist governments to respect, protect, and fulfill our rights. It will guide them to design and implement policies that are human rights-based and to be accountable. It will raise awareness of all sectors of society and all generations that we all have the same rights and that we should all age free of discrimination. We need a solid legal foundation to end systemic ageism. We welcome the global leaders that they are coming together to address the dramatic impact of COVID-19. Now we need to see these commitments reflected across all UN programs, both globally and at country level. We need the commitment of governments at community, local, and national levels. Let us sit at the decision-making table and act together. The joint program in Eastern Europe and Central Asia that was mentioned earlier is a good step in that direction. The decade of healthy aging can be too. We need investment, not austerity measures. We call on all civil society groups to work with the organizations that represent older persons to make sure that everyone is included in the recovery efforts and beyond. The decade of healthy aging will be successful if our rights are upheld wherever we live, whatever our status, ability, or age, until our last breath. Thank you.
Thank you, Sylvia. That was straight to the point, to our minds, but to our hearts also. Thank you so much for that. We had planned to have some time for some questions and some comments. I will start by giving the floor to Ambassador Rita French, the United Kingdom Human Rights Ambassador. Ambassador, you have the floor.
Thank you, Monica. Friends and colleagues, thank you for organising this important event today and for bringing together such a distinguished panel of speakers. COVID-19 is and will continue to be an exceptional challenge, and we know that older people face particular issues with the virus. As we have heard, they are at greater risk of serious complications, including death, and that they're more likely to be affected by the socio-economic impacts of the virus. Even without COVID, discrimination, marginalisation and exclusion continues to exist. But while we are mindful of the challenges older people face, we know that they play a vital role as friends and family, as caregivers and educators, as leaders and volunteers, and as a source of experience and inspiration. In our recovery from the crisis, and as we build back better, we have an opportunity to heed that experience and to listen for that inspiration. I'm delighted Dr. Tedros spoke about his meeting with Captain Sir Tom Moore. Captain Sir Tom, the UK war veteran who raised over £32 million for the National Health Service by completing 100 laps of his garden before his 100th birthday, truly brought inspiration and continues to bring inspiration to millions of people around the world. Together, we have an opportunity to think about how we support people of all ages and how we can draw on the best that our people have to offer, however young or old. The UK has committed to include age as a factor in our development programmes and in all our efforts to promote a fairer world. Many of our programmes already reach older people, like our work to strengthen the health systems, assistive technology and eye care. Others are specifically for them, including work on social protection. In addition, across government, there is specific guidance to include older people in COVID response activities. I'm pleased that the UK is working with our international partners on the rights of older persons and the possibility of a dedicated multilateral instrument. Let us build back better. Let us build more inclusive, less discriminatory societies for all, however old or young. Thank you, Monica.
Thank you so much, Ambassador. We have a couple of comments and questions in the chat box. Unfortunately, we have no time to address them properly, so we will try to our best to save the messages and the comments and the questions, and then try to address them later. Let's try to save the information that was there. And now, inspired also by the remarks of Ambassador Rita French, we're gonna move swiftly to the closing part of this event. Not without pity, because it's been amazing. I'm sorry, I'm really impressed by the way this has been going and by the statements we heard. And I want to thank you all for the reach and the very diverse perspectives that we have here through this hour. And I would like to welcome Dr. Naoko Yamamoto. She's the Assistant Director General for WHO Healthy Population Division in WHO. And over to you for closing comments.
Thank you, Monica, and thank you, Ambassador Federico, to allow me to speak before you. But maybe ladies first, please. So thank you. But Excellency, dear friends and colleagues, first of all, I want to thank you all today's participants for this valuable insight. And as a global community, we have not done enough on aging and for older people, not only during the COVID-19 crisis, but even before the pandemic hit. As Madame Michelle Bouchet or Dr. Tedros or Dr. Kamem said, that we have an opportunity to change that. To foster healthy aging, we need to work together. This must be our new normal. We hope that the decade of healthy aging will be endorsed very soon by the broader UN system. Together, we can shape a new world in which people of all ages can live with dignity in full enjoyment of their human rights. The discussion today has highlighted the many ways in which we can be stronger together by listening the voices and the stories of older people, by changing not just what we do, but how we think and feel about aging and older people, and through more age-friendly environments, by monitoring progress so that some older people are not left behind, and by partnering with all stakeholders, including government, the UN, businesses, and civil society to build a more age-friendly world. Thank you to OCHA, UNFPA, and the NGO Committee on Aging for jointly hosting this event. Thank you, Claudia, Sylvia, and Ambassador Rita. Also, I need to ask, thank you, Ambassador Frederick, he will, of course, he will speak later, but for your commitment to healthy aging and to the world that treat all the people with the respect and dignity they deserve. That's the world we want, and that's the world we will work with you to achieve. So I thank you very much for.
Thank you, Nawako. It's clearly the world we want, a world with more participation for all and with more dignity. Thank you so much. It was a wonderful way to get to the end of this event. And now, last but not least, I have the honor to introduce Ambassador Federico Villegas. He's the permanent representative of Argentina to the UN here in Geneva, and he's also the co-chair of the group of friends of the human rights of other persons in Geneva. Ambassador, tem a palavra. He speaks Portuguese. I'm sorry, but I had to do this. Ambassador, you have the floor.
Can you hear me now? Muito obrigado, Monica. And thank you very much for the invitation. And thank you for the organization of this important event. I congratulate the proposal of having a decade of healthy aging. But I would like to pose the question, how do we want to finish that decade? What do we want to achieve? And honestly, we have to think that in order to have a healthy aging, we need the rights, the human rights of older persons to be fully respected and fully protected. And I think we have too much information already that their rights are not being fully respected or protected. So do we want to finish the decade just as we started it? Or perhaps we can finish the decade with a new international instrument for the protection of the human rights of older persons. We have to build a consensus around this new instrument, the same way that after a long process, we were able to build a new instrument for children, for women, for persons with disabilities. It took many discussions, but we have been discussing already a decade about this. And an assessment of the vulnerability is very clear. And COVID put us in real persons dying, the abstract discussions we have been having in New York and Geneva about the rights and the vulnerability. So I just wanted to finish this with encouraging people to think that if we really want the new normal should be that countries start openly working for having a new instrument of international law that will protect the rights of other persons. Thank you very much, and thank you for the invitation. Congratulations.
Thank you so much, Ambassador, for this call to action. I think that throughout this hour, we heard many times talk about human rights, the need to give voice, to recognize the agency of other persons and their organizations. We heard calls for giving them a seat at the table, making sure that Build Back Better means building back with the participation of other persons. And I think that the ambassador just wrapped up with the perfect message. We've heard the conversation, now it's time for action. And for those of you who want to keep engaging also in the conversation, I have to invite you to follow the event that is now starting precisely now in New York in a different channel that will also celebrate the 30th anniversary of the International Day of Older Persons, and that will include a message from our Secretary General, Antonio Guterres. From my side, I have to say that I feel challenged, inspired, and we really need to seize the moment because this is a wake-up call that we all got, and now it's time for action. Thank you all very much. Wishing you a wonderful day, and let's meet soon in cyberspace. It's the beauty of this global events. Thank you so much. So.